According to the CDC, Black infants are 3 times more likely to die before their first birthday than white infants.
And the 10 most populated cities, Philadelphia, we have the highest infant mortality rate. We've got to change this. We have Salima McNeil, the founder of the Oshun Family Center, who says those numbers are what prompted the creation of the Black Maternal Health Week.
And we're also joined by Portia Holland Otumba, who went through a traumatic birth experience and struggled with breastfeeding. And that was a couple years ago now.
Yes.
Because now you have 2 kids, right?
Yes, 5 and 1.
5 and 1. But tell us about your experience then, especially with your first child, and what was so traumatic about it.
Yeah, so my first baby girl, she'll be 6 this year. I went in thinking everything was okay at my 40-week appointment, ended up having a concern that led to me being induced, and she just did not tolerate it well. She didn't like it. We had deceleration of the heart. There was a concern, emergency cesarean. And so that's where we ended up.
And what was that like for you, going through that and having all that happen?
It was a whirlwind, feeling like I wasn't in control. There wasn't much that was explained very well. I didn't understand, didn't think that that was even a possibility for me. And so I really considered it traumatic, just not being in control, not being heard, not having things explained the way I want to, and having a say throughout the process.
And to have it happen so late, where you're so far along in the process, not given a heads up that these are the many different variables that can happen. Here's different things and precautions that you can do.
Absolutely.
Did you have anything similar with your second child, or how did that one go?
So with my second baby girl, who just turned 1, similar that I had preeclampsia. So I'm at least fourth generation preeclampsia. So it does run on my maternal side. And it led to an induction, but I was in control this time. Now as a trained doula, childbirth educator, I knew what questions to ask. I staffed my team essentially and made every single plan throughout the process, but it did end up in an induction and also an unplanned cesarean. However, I was empowered, felt in control, and guided the entire process this time.
And I'm sure that made the difference. So what do you think when you hear about information like this, where we say how hard it is for Black women who are going through pregnancy and going through childbirth, and then when it comes to the infants, at least making it to their first year of life?
Yeah, it's a reality. Being bedside as a doula in many of our city's hospitals, I've seen some close calls and some scary things, and so it really is a reality. It's striking, it's difficult to stomach, but it's part of the reason why I do what I do in terms of Black maternal health specifically.
It's so great. And so, Salima, we have great events that are happening this week. How can people get information, what things are going on? Let's take a look at some of the events that are happening. Let's start with 413 and see what's happening, that people can get involved and get educated.
Yes, 413, we are heading to Harrisburg. We're going to charter a bus, and we're going to meet at Castor, Wyoming at the new Temple Women's Hospital as our starting ground as we venture to Harrisburg to have those conversations with our legislators that really lend to the advancement of Black birthing bodies as legislation and policy pieces are introduced. So we get to have those conversations on that day.
Because part of it is awareness, right? Knowing that there is, it's not even and it's unfair for Black women, and making sure that things are being done to rectify that. Okay, and then the next day?
Oh, our Black Birth Workers Brunch. So in our city, we have a really good collective of Black birth workers where we're going to be in community at the Discovery Center, which is in Strawberry Mansion on Reservoir Drive, right across the street from Smith Memorial Playground, which we will be on Saturday for our community baby shower. So we have about 20 slots left for our community baby shower. Register so you can come and get a pack and play, a car seat, resources, childbirth education, lactation support, and family.
And where do you sign up for that?
On our website at bhmwphilly.org.
bhmwphilly.org. Of course, we'll have that probably on our website as well. And then moving through the week?
Yes.
The next day?
Sunday, we have a memorial walk for those who are not here to tell their own stories, infants and birthers. So we have their families that we're going to be at the Discovery Center doing a walk. And then Monday is our grand closing at Temple Student Faculty Center, where we will have a perinatal equity symposium.
One of the things I like that you're doing is you have to share your own birth story, because I think that's what's so important, because people think like on Instagram it's like you fall in love and you have a baby and it's like, you know, rainbows and balloons. And I think the more that you tell the nitty-gritty of just about like what that experience on even the most perfect technically, you know, birth, like what can can occur, I think we all need to be sharing our stories so women are like, they know what happens.
Yes, and actually Portia and I worked with a few birthers here in Philadelphia to help develop and curate their birth story over a couple sessions. So we're going to record at the baby shower because they have an opportunity to work with our audiovisual team, and then we're going to share at the symposium with their permission.
And it sounds like knowing what to say and what questions to ask is also a very big part of it, right?
Absolutely. Advocacy, knowing that you have a voice, that just because you're walking into a system, if you choose to birth in a hospital, you have the right to question, you have the right to refuse anything that doesn't sit well with you or that evidence doesn't support that it's best for you.
And you can have a doula.
Absolutely.
Yes. And you can have people, and there's a lot of, most of the hospitals are now creating situations where they also have midwives, either as a practice or as a section, or they're incorporating that because they hear women's voices that they want to control what happens to their bodies and their birth experience.
As we should, yes.
Absolutely.
It looks like it's going to be an amazing week. Thank you for the work that you're doing. And we have all that information on our website so you can be a part and to help with this mission.
And wait, one more. We have a new app. I don't want to forget. There's a new app that women can use. Tell us about the app.
Kimberly Sears-Allers, founder of the Earth app, Drop the B for Bias. We are in community partnership and collaboration with her. We have come together to hire Earth ambassadors, in which come to community events to solicit reviews from people who have recently given birth and or are a doula, so they can outline their experience working within the health system to better understand things that went well and things that did not go well, so we can use that data to help curate better experiences for Black birthers across the nation.
So if you selected a hospital that you're working with, you'll be able to look up that hospital and see other birth experiences that women have had.
Yes.
That is amazing. And it's Earth, IRTH is what you search for?
Drop the B for Bias, birth.
Okay, wonderful. Thank you, ladies. That is important.
You.
Thank you both for sharing your stories. We appreciate it and your work.
Absolutely.